Greetings everyone. You're tuned in to Dr. Nguyen's YouTube channel, your reliable source for all things health related. Today we're unraveling the mystery behind tonsillitis and tonsillectomy surgery. Tonsillitis is a common condition that affects many. But do you know why tonsillectomy surgery might be necessary? Well, that's exactly what we're here to explore. So buckle up and prepare to learn as we dive into the world of tonsils, their ailments, and the surgeries that can help. Stay with us as we delve deeper into the symptoms, treatments, indications, and complications of tonsillitis and tonsillectomy surgery. First, let's identify the symptoms of tonsillitis. Tonsillitis, a common condition affecting the tonsils, presents a range of symptoms that can vary in severity. The ability to recognize these symptoms early can make a significant difference in obtaining timely treatment and avoiding potential complications. One of the most noticeable symptoms of tonsillitis is a sore throat. This discomfort can be mild or severe, often accompanied by a scratchy sensation. It can be a constant irritation or become more pronounced when swallowing. The pain can sometimes extend to the ears as well. Difficulty swallowing is another common symptom. The inflamed tonsils can swell and restrict the passage of food and liquids. This can cause discomfort, and in some cases, can lead to dehydration if the person avoids drinking due to the pain. Visible changes to the tonsils are also a telltale sign of tonsillitis. The tonsils may appear swollen and red, and white or yellow patches, known as exudates, could cover the tonsils. These changes often indicate an active infection. Fever is often present with tonsillitis. The body's immune response to the infection can result in a high temperature. Accompanying the fever, one may also experience headaches and chills. Additional symptoms can include bad breath due to the infection in the throat, a stiff neck caused by swollen lymph nodes, or a muffled voice, often described as hot potato voice. In children, symptoms can also manifest as abdominal pain, irritability, and a lack of appetite. One thing to remember is that these symptoms don't necessarily confirm tonsillitis. They could be indicative of other conditions, such as a common cold or strep throat. It's essential to consult with a healthcare professional if you or a loved one is experiencing these symptoms. A proper diagnosis can ensure that the right treatment is administered. It's also important to note that the severity and combination of symptoms can vary from person to person. Some may experience only a few of these symptoms, while others may endure them all. Recognizing these symptoms early can help you seek treatment promptly and prevent complications. So, stay vigilant and remember that your health is in your hands. Now that we've identified the symptoms, let's discuss the treatment options for tonsillitis. Tonsillitis can be a real nuisance, but fret not. There are several treatment options to alleviate the discomfort and help you recover. The first line of defense is typically antibiotics, especially if the tonsillitis is caused by a bacterial infection. Your doctor may prescribe a 10-day course of penicillin or amoxicillin. It's crucial to complete the entire course, even if you start feeling better midway, to ensure the bacteria are completely eradicated and to prevent any recurrence. For cases where the tonsillitis is viral, antibiotics won't be effective. Here, the focus is on relieving the symptoms while your body fights off the virus. This is where pain relievers come into play. Over-the-counter pain relievers like ibuprofen or acetaminophen can help reduce fever and alleviate throat pain. But remember, always follow the recommended dosage. Now, let's not forget the power of good old home remedies. Warm fluids like soup or tea can soothe a sore throat, while cold treats like ice cream can help numb the throat and provide temporary relief. Gargling with warm salt water several times a day can also be beneficial. And of course, plenty of rest and hydration are key to recovery. In severe or recurrent cases of tonsillitis where the condition affects the quality of life, a tonsillectomy, which is the surgical removal of the tonsils, might be considered. But we'll delve deeper into that in the next segment. It's critical to consult with a healthcare professional to determine the best course of treatment for you. What works for one person might not work for another, as the most suitable treatment will depend on the severity of your symptoms, the cause of the infection, and your overall health condition. And let's not forget prevention. Good hygiene practices like regular hand washing, avoiding close contact with sick individuals, and not sharing personal items like utensils or toothbrushes can go a long way in preventing tonsillitis. Remember, the most suitable treatment for you will depend on the severity of your symptoms and your overall health condition. Sometimes medications and home remedies aren't enough. That's when a tonsillectomy might be necessary. A tonsillectomy, which is the surgical removal of the tonsils, is not a decision to be taken lightly. It's a procedure that comes into play under certain conditions. Firstly, let's talk about chronic or recurrent tonsillitis. If you're someone who's been battling tonsillitis more times than you can count on both hands in a year, or if it's a battle that's been going on for over 2 years, then a tonsillectomy might be on the cards. It's like being stuck in a loop of sore throats, and it's exhausting. That's when your healthcare provider may suggest getting those tonsils out. Next, let's talk about complications of tonsillitis. Sometimes tonsillitis can lead to some nasty complications like a peritonsillar abscess, which is a pocket of pus near the tonsils. This can make swallowing a nightmare and can even obstruct your airway. Not fun, right? Or it can lead to a condition called rheumatic fever, which can damage your heart. In such cases, a tonsillectomy might be necessary to prevent these complications from recurring. Lastly, there's obstructive sleep apnea. This is a condition where your breathing stops and starts during sleep, and it can be quite dangerous. Enlarged tonsils can cause this, especially in children, leading to snoring, restless sleep, and even behavioral issues. A tonsillectomy can help ease these symptoms and lead to a better quality of life. But remember, a tonsillectomy is a surgical procedure, and like all surgeries, it comes with its own set of risks and complications. It's not a decision to be made lightly or without the right medical advice. It's important to have a thorough discussion with your healthcare provider, understanding the pros and cons, before deciding if a tonsillectomy is the best course of action for you. Always consult with your healthcare provider to understand if tonsillectomy is the best option for you. It's your health, your body, and ultimately, your decision. Make it a well-informed one. Like any surgical procedure, a tonsillectomy is not without potential complications. Despite being a commonly performed surgery, it's important to be aware of the possible risks associated with this procedure. The most common complication following a tonsillectomy is bleeding. This can occur during surgery, immediately after, or even a week or two post-operation. It's normal to see a small amount of blood in the saliva, but excessive bleeding requires immediate medical attention. Another potential complication is infection. While the risk is relatively low due to the use of antibiotics during and after surgery, it's still a possibility. Symptoms of an infection may include fever, severe throat pain, and difficulty swallowing. If you experience any of these symptoms after a tonsillectomy, it's important to promptly seek medical help. Reactions to anesthesia are also a potential complication. These reactions can range from mild nausea and dizziness to more serious issues such as breathing difficulties or allergic reactions. The risk is generally low, but it's a factor to consider, especially for those with a history of adverse reactions to anesthesia. Other less common complications can include changes in taste, voice changes, and difficulty swallowing. Some people may experience a change in the way foods taste following the surgery, but this is usually temporary. Voice changes can occur as the throat heals and adjusts to the absence of the tonsils. Swallowing difficulties are usually short-lived, but if they persist, it's important to consult with a healthcare provider. Lastly, there's the risk of dehydration. After a tonsillectomy, it can be painful to swallow, making it difficult to drink sufficient fluids. Dehydration can lead to other complications, so it's crucial to try and keep up fluid intake, even if it's uncomfortable. Remember, while these complications may sound alarming, they are relatively rare, and tonsillectomies are generally considered a safe procedure. The key is to discuss all potential risks with your healthcare provider so you can make an informed decision about the surgery. Understanding these risks can help you make an informed decision about undergoing tonsillectomy surgery. Being informed is the first step towards a successful recovery. As we wrap up, let's quickly recap what we've learned today. We've explored the symptoms of tonsillitis, delved into the treatments available, and identified when tonsillectomy surgery might be necessary. We've also touched on possible complications that can arise post-surgery. It's crucial to be informed and comfortable with these aspects, especially if you or a loved one are considering such a procedure. Thank you for tuning in to Dr. Nguyen's YouTube channel. Remember, your health is your wealth. Until next time, take care.